Saw a note from Sue Nethercutt on Twitter that 10% of the people on the transplant list for new lungs are there because of COVID. This is serious stuff. And so what's the state of the pandemic or epidemic or whatever we're calling it these days? On the line with us is Dr. Eric Feigl-Ding, the epidemiologist and senior fellow for the American Federation of American Scientists. He's the first whistleblower of the COVID pandemic, former faculty member and researcher at the Harvard Medical School and the Harvard T.H. Chan School of Public Health. His website is fas.org, or actually the best way to follow him is to go to Twitter and get at Dr. Eric Ding, D-R-E-R-I-C-D-I-N-G. Dr. Feigl-Ding, welcome back to the program. I understand that since the last time we talked, the plague got you. How you doing?
Thanks for having me. Yeah, that was three and a half weeks ago. I tried to do the best I could, but my kid brought it home from school, and by the time we realized he was positive, it was too late. Yeah. I was positive the next day. Yeah.
Was it the Omicron? It didn't whack your lungs too bad, and you're okay?
Well, we didn't know the exact variant, but I suspect it was probably BA2. Yeah. I didn't get the first Omicron in the first wave. Yeah. And I think, I had fever and chills for like 2-3 days, but luckily I had Paxlovid, although that was quite an ordeal to try to get it. And then I felt better for a few days, and then I had a lingering cough again coming back, and I've had the lingering cough ever since.
Oh, geez. Well, I'm sorry to hear that. I hope you get better. I'm reading that there's two new variants, BA4 and BA5, that are running like crazy through South Africa and are apparently more contagious than BA2 or the variants of BA2. Yeah. Is this a concern for us outside of the unvaccinated community in the United States?
Oh, I think it is a concern because one of the studies for BA4 and 5 shows that even if you had the original Omicron, we're not talking about original Wuhan, that was ancient history. If you had the original Omicron back in December or January, your protection against BA4 and 5 is incomplete. It's much weaker. So people always forget the protection you have from a previous infection, God forbid, and hope you survived, is that you have protection against that variant. You don't have full protection against future variants. And so this, assumption that, you can't get hit again is just not true because, we think the reinfection window is probably about 3 months after your previous infection, you're susceptible again. And we've seen this in the UK as well, that, their BA2 wave hit exactly 3 months after their BA1 peak. Now, BA4 or 5 are still mostly in South Africa, but they have been identified in North America as well. But the problem here is BA2 and its daughter variant, BA2121, is actually surging even faster. So it becomes right now a rat race of which variant is going to be worse. And that is a really bad situation to be in because we know there's so many fast and evasive. And evasive here I emphasize because now, in this stage of the pandemic in which most people have been infected or vaccinated, it's basically not the virus that sprints the fastest, but the virus that can pole vault the fastest over your existing immunity to previous COVID. And so I really, really emphasize people need to be vigilant.
Yeah, I totally get it. So are we in the middle of an invisible COVID wave? I was telling my audience a little earlier over the weekend I had to buy a circuit breaker, and I went to Home Depot. And, there were a couple hundred people in the store, and myself and one elderly couple were the only ones wearing masks. It's like, hey, it's over here.
Yeah,
and
this is a very false
one of the
narrative.
Better places.
It's not over because, first of all, even New York is admitting that cases are up 50% in 1 week. And we're not testing enough because testing officially, the problem is most home tests are not reported. Like even my test, I tried to report my positive test. I had no idea how to actually report my case.
And you're an epidemiologist.
I know, but there's no system through my health department to report the case unless I actually go and get a PCR test. But then I'm like, I'm not going to line up outside in the CVS when I know I'm positive to get that test and try to register. It was just not worth the public health risk. And so this is a horrible situation right now. We have testing, but it's silent. The wastewater is the best metric, and wastewater clearly shows a rise. Hospitalizations haven't risen yet in the U.S. as much, but they have risen a bit, and the fall has completely stopped. And England, we're always a couple weeks behind England, about a month or two, sometimes 2 months. But they had like a hospitalization peak that's actually surpassed their previous Omicron wave. And it's really, really worrisome that I do not want another Omicron wave because of these new variants.
So what do you say to folks who say, well, you know, I know a lot of people who got this and you know, they were sick for a week, but you get really sick for a week from the flu too. And, you know, it's everywhere. I can't avoid it. It's going to be inevitable. This is the new reality. And I'm not willing to put my life on hold anymore. I'm going to go to a restaurant this afternoon. Screw it.
Yeah, I think, you know, I can't tell everyone what to do, and that's not my job. But the issue, the reality epidemiology-wise, is that even if you're boosted, and even if you meet 10 people who are fully boosted, the issue is, although none of your bridges will collapse, let's just pretend you as a body is like a 4-lane highway bridge. Although none of you will go to hospital or die, likely, the problem is that you're still carrying, you know, the transmission. You're still very likely carried. Even with 2 shots, with 3 shots, you only have like 45% efficacy against symptomatic transmission, even lower against asymptomatic. So you're still allowing the virus. You close 2 lanes out of 4 lanes of the highway. You're still carrying it to other people, and eventually, you know, we know that a more contagious virus that's less severe will kill more people than a more severe virus that's less contagious. We have a very, very contagious virus. And even if it's less severe, the fact that we allow it to spread unchecked is dangerous. And I remind people, 2 shots is not enough. Your protection against hospitalization and death is no longer 95, 99% with 2 shots. With 2 shots, your protection, according to England against BA2, is only 59% lower risk. Now, this isn't like a 50-50 coin toss. It means like your risk is cut in half or more, but not the 95% number that you used to be used to when the results first came out in late 2020. So you need to get a booster, and maybe another booster if you're highly immunocompromised and eligible.
So what do you, and obviously, you know, we want to carve out an exception here for people who are immunocompromised, people who are elderly, people who are in terrible health, people who have heart failure, things like that. You know, they probably just need to hide out for a while here. But how do you respond to this growing meme I'm seeing that, hey, I've got my shots, I got my booster, and now I'm going to get COVID because that's going to trigger a different part of my immune system, and it's going to fill, you know, it's going to completely fill out my immunity complement, and I will be more immune going forward. I hear the major rebuttal to that is that natural immunity, as you mentioned just a moment ago, only lasts 3 months. But does that mean that, you know, we're all going to be getting sick a couple of times a year when we do all get back to normal? Or I guess the larger question is, how and when do we get back to normal? Or is there no new normal?
Yeah, I think a new normal, by the way, the word new normal is being abused. I think the issue is that we have to face a new reality. The new reality is that this virus is very, very contagious. Is very evasive. It creates new variants very easily, especially when you infect millions or 1 billion people over the last few months. And if stopping transmission is more important than just saying, oh, you know what? We don't need to buckle our seatbelts. Hospital beds are not full. We don't need to, you know, not drink and drive. But we've already
lost, forgive the interruption, but I see a break coming here. We've already lost that battle. I mean, you know, I can't get on an airplane now.
Yeah, the issue is not enough people are boosted. Oh, okay, if you're boosted, you know, I'm going to basically say, yes, it becomes very difficult to control people and tell them what to do.
Right.
But if you're not 3-shot boosted, and I would say most of America is not 3-shot boosted, you have to be careful. And children, only 30% of children 5 to 11 are even vaccinated with 2 shots. And children under 5 are not. So at very least, think of the children. And it's not just deaths, it's also long COVID as well. And you can get long COVID even without any hospitalization. 20, 30% unvaccinated, 10%, 5 to 10% of vaccinated people. And if you think about how many people have gotten infected, this is something we cannot allow our society to continue, because ultimately, for now, things might look rosy, but the long-term impact on our society on long COVID, the cost, the burden on the workforce, on families, it is just so morally bankrupt to keep letting this virus spread.
Yeah, so 3 months down the road, when the natural immunity from your COVID infection last week wanes, would you get on an airplane?
I would definitely wear an N95 mask. And this is what upsets me. Also, that two-way masking, if both the source, someone expelling aerosols, and the receiver wear masks, that's way better. Think about it. Like 95% and 95% together, the chance of you getting infected is much lower. So I would get on the airplane, but I would definitely wear an N95 mask. Don't listen to the guidelines about that, not wearing a mask on airplanes. Please wear a mask and turn on the overhead fan as much as you can, and try not to take off the mask if at all possible.
Yeah, it's a wild ride here. Last question: how do you see this going? Do you think that there's going to be some nasty variants coming down the road?
Yeah, I think the thing is, nasty variants, people think of nasty variants as like a deadly variant, but I would say that a nasty variant is an invasive variant that's going to reinfect you. And even if it's milder, a very reinfectious, highly invasive variant is ultimately what will kill more people. And that is what I worry about more than just like a highly deadly virus. So stop the transmission. That's the way we actually end COVID.
Yeah, no easy answers here. Dr. Eric Feigl-Ding, thank you so much for dropping by today. You can follow Dr. Feigl-Ding at Dr. Eric Ding, D-R-E-R-I-C-D-I-N-G on Twitter. Thank you so much, sir.